Hey everybody, my name is Brian Ward and I want to welcome you to the third episode of the Arkham Sessions. As always, I am joined here by my co-host, Dr. Andrea Letamendi.
Hi.
And we want to welcome everybody back from the holidays, whether it was Christmas or Kwanzaa or Hanukkah, what have you. Hope everybody had a safe and very happy holiday season. And now we're getting ready to start a brand new and hopefully fantastic 2014.
I'm very excited.
I know you are, because we are now going to analyze the first episode of one of your favorite characters, I know, Dr. Jonathan Crane.
Right. So many people know Dr. Jonathan Crane as the Scarecrow.
And of course, we all know the Scarecrow as the master of the phobia.
Right. So he has found a way to instill or draw out fear and anxiety from his victims, which can be incredibly incapacitating to people when they're faced with, or they're at least hallucinating or imagining their worst fear. And in this episode, we see some really great examples of how he does this.
So, talk a little bit, just some real life experience. You've dealt with phobias, right?
Yeah. In fact, during my doctoral studies, I was working at an anxiety and traumatic stress lab. And actually at many universities, there is an anxiety and stress or anxiety and trauma center or lab, essentially a place where there are treatments offered, there's research going on. And during my stint there, I was an evaluator, an assessor, and treated many anxiety disorders. Actually, phobias, we call them specific phobias in my field. Specific phobias are quite common, and the prevalence rate is about 12%.
So this would be, phobias obviously range in all kinds of things. I mean, we know people afraid of snakes, afraid of spiders, afraid of heights.
Right, and there's actually different classifications of phobias. So you're right, some folks are afraid of specific animals, cats, dogs, snakes, reptiles. Other folks are afraid of situations, like being in an elevator, being on a bridge, heights, that kind of thing. And there are actually a lot of blood phobias, or fear of injection or needles, or even seeing blood. And there are very effective treatments for these types of phobias that are very widely offered and, are pretty common as far as psychotherapy goes.
Cool. Dr. Crane's research in a university setting, maybe not all that unrealistic.
No, I mean, what's kind of cool is that we see in this episode, we see some flashbacks of his work at a university lab. And although his techniques are a bit unethical, which we can talk about, his scientific environment is actually quite realistic. He's at a university lab. They even show the board, or ostensibly a number of other scientists or experimenters who are evaluating and approving his research, which is what we do. So if you can imagine, I'm sure while you were in college, you heard about different experiments or psychology labs offering credits or even, a few bucks to participate in a study. That's actually very common. So I really liked that in this episode, you kind of see a glimpse of Dr. Crane as a professor working at a university and undergoing these projects and trying to, what I would imagine is move science forward.
So this episode, just like the last episode, I think we're going to have even more fun analyzing Bruce Wayne than we are the Scarecrow, because the Scarecrow, I don't know necessarily has anything. I mean, he's certainly a little bit on the sadistic side.
Inducing terror has always intrigued me.
I wouldn't say that he's necessarily got something that you would treat.
Well, I don't know that we have enough information just from this episode, but you're right. I mean, similar to past episodes, what's great about this episode is that, sure, we have this villain who's interesting and mysterious and who needs to be stopped because he's doing something horrific or he's doing something illegal and potentially dangerous. But what we see is that brings out some psychology in Bruce Wayne that that's very telling, and that may allow us to see some side of Bruce Wayne that we wouldn't see without this villain drawing it out. So that dynamic is here as well.
So let's talk a little bit about, we start the episode out, it's at an event at the university. Bruce Wayne is moving toward the elevator along with Summer Gleason and another professor. He basically overhears the conversation. That other professor announces that he knew Thomas Wayne well and suggests that Bruce has sort of soiled the Wayne name.
When your father was alive, Wayne was a name that commanded great respect. Now all Wayne stands for is a self-centered, jet-setting playboy. It's lucky your father didn't live to see what you've done to his good name.
On one hand, Bruce doesn't really seem all that fazed by that, but then once that professor and Summer leave the elevator, Bruce, you could see, has sort of taken that to heart. Bruce does, in fact, seem to have a lot on his shoulders, but this is kind of where I've always had a problem with the Bruce Wayne character in general, whether it be in comic books or movies or the animated series. Bruce almost has to intentionally soil the Wayne name to get the job done as Batman. He's not really making Gotham proud as a Wayne. He's making Gotham proud as Batman.
Right. I think what we're seeing, though, is that this old professor, his name's Dr. Long, he apparently went to college with Thomas Wayne.
Right.
And so he makes this remark to Bruce Wayne about, like you said, he's his father would be very ashamed and wouldn't be proud of him. And, I think you're right that he wouldn't be surprised to hear something like that. But it's not so much Dr. Long's assessment of him. I think it's potentially the hint of truth there. It's not so much what society thinks about him, it's what his father thinks about him. And so he might be having this moment where there could be truth to that. What if his father is disappointed in him? What if his father does think he's a failure? And I think this is important for this episode because it almost it kind of lays down this kind of fundamental tone here that this is starting out with him being uncertain and being disappointed in himself, and that there's this underlying component there.
So we move on throughout the episode. The Scarecrow has revealed himself. He's breaking into the university's bank across the street from where this event is taking place. And he makes it clear that he's not there for money.
This isn't about money. It's about revenge.
He has been fired from the university for his unethical treatment of students or subjects in studying his phobias.
Right. So he's, as we said, he's set up these experiments, and we do see in a flashback what he's doing. So he's got participants or subjects in these rooms, and he's exposing them to in vivo stimuli, which essentially is the real thing. So he's got, I think, like snakes and spiders, and people are covered in these things, and rightly so, they're having anxiety attacks and they're screaming, and it's clearly unethical what he's doing. So
is this what you guys would call flooding, or?
Well, it's unclear what he was doing, but my understanding is that he is interested in the process of fear, right? So it makes sense that what we would do in an experiment with human subjects is to put people in very real life situations. If we want to study the pathology of fear, if we want to study the chemicals related to fear, brain functioning, behavior, all that stuff, you would want the closest thing to that situation. And a lot of times we would put willing participants, subjects who have volunteered to be in these studies, to be in MRI machines or to be in social situations or be exposed to things that might make their heart rate go up and they might have panic attacks, and that's not unethical right there. But it's my understanding the way that we look at these flashbacks is that these folks are are surprised at what's going on. They seem to be unwilling to be in these experiments. They were clearly being taken advantage of. Their evaluation essentially is that what he's doing is unethical, and not only do they pull his funding, it sounds like they let him go. They fire him from the university, which is a huge blow to his ego because he sees himself as this, mastermind of psychology.
So now, they will learn the true nature of horror.
And what we gather from that is that, unlike Man-Bat, right, who was looking to find some kind of, superior combination of genes he was trying to improve the human race. We're not really clear on what Scarecrow is really doing. It's almost like he's just kind of doing it to get some kind of... the benefit to him seems to be this experiment itself.
People, animals, it was all the same.
And so I want to be clear that experiments involving human subjects and involving things like phobias, anxiety disorders, and fear, that's not unethical. What's unethical is when you conduct these studies and actually harm people, or animals, of course, or if you're even running a study and it doesn't seem to move science forward, right? It doesn't involve any kind of new discovery. It doesn't have an impact on the field, then you're really not going to get approval for that. So I think this was a clear case of, what he was doing was not only harmful to people, but wasn't really worth it. It wasn't moving science forward.
You had talked about exposing people to, you might expose people to the closest thing to reality. What are those therapies called, and what are you actually doing? What are you hoping to gain from that?
Mm-hmm. Well, for many years, I treated something called social phobia or social anxiety disorder, and it's not considered a specific phobia, but social phobia is a very impairing psychological problem or condition where someone is so uncomfortable, anxious, fearful, being in social situations. And so a very effective treatment for that kind of condition is to set up these very safe but realistic social situations where someone can have experiences actually being in very real life situations to overcome their anxiety. And it has a lot to do with experiencing the discomfort, anxiety, and fear in that situation, but also there's this thing called corrective learning. Their brain learns that these scenarios that their body felt like and thought that were dangerous, they're actually okay. They're actually safe situations. And so with enough, I want to say, iterations of these social encounters, or what we call exposure therapy sessions, these folks will learn that it's not harmful to them. There's actually changes in the brain.
So what is the difference between exposure therapy and something like flooding?
Well, you've probably heard flooding before as a psychological treatment. Flooding is a type of exposure therapy, and flooding actually is like the number one treatment. It's the most effective way to get rid of any kind of specific phobia. But flooding is very intense. It's like basically whatever you're afraid of, you do it at 100% all the way, no meds, no alcohol, like you just face your fear. And
so when Tyra Banks had people reaching into jars of pennies because they're afraid of pennies, but there's a diamond watch at the bottom.
Is that from her show?
Yeah. Back in the day, she used to have these episodes where she would reveal, like, she's afraid of dolphins. But she would go swimming with the dolphins, and then she would have other people come onto the shows, and she'd be like, you can have this diamond watch, but it's in a jar of pennies. And you're deathly afraid of pennies. So reach down through the pennies and you can get the diamond watch. And so she would make these people do these things.
That's the equivalent of flooding, essentially, is to face the fear in vivo. It's right there in front of you. You're touching it, you're tasting it, smelling it, whatever. It's there with you. The fact that there's a watch there, though, there's an incentive, and believe it or not, that may make that particular treatment less effective because you can almost explain away the...
You're willing to do it if there's a bonus
Right.
But there won't always be a bonus.
You're getting something out of it, so you're willing to do it. And
Right.
you may not get that corrective learning that I mentioned. You may not get that benefit from it because you may explain your ability to do it because there's this incentive. There's this very real incentive there. As simple as it sounds, the best way to overcome some kind of phobia is to face it head on, in real life. Unfortunately, we tend to not rely on flooding as a treatment because, for one, it's very difficult to get folks on board to, first of all, explain why this would be helpful, but to get someone who's so afraid of flying they won't even, look at a picture of a plane, to get them to buy a ticket and board a plane. That's really unlikely that someone's going to go through with that. It's not dangerous or harmful, but it certainly is one of the most uncomfortable types of therapy to put someone through. So we prefer treatments that are still exposure therapy, but we prefer gradual exposure therapy. So that would be, take this social phobia example, maybe getting on the phone and making a phone call to someone. Maybe the next step would be going in person to a store with a friend and making a purchase or ordering something. Maybe the next step would be going to a stranger and just introducing yourself. So as you can see, they're getting increasingly more difficult in terms of the social challenge and certainly in terms of the anxiety that this person would experience. But they get to have this gradual experience where they have successes along the way. They're gaining the ability to actually go through with some of these scenarios.
So how is that sort of treatment and what Crane is actually doing? What is the difference between ethical treatment and unethical treatment?
I hear what you're saying. I have actually been in a therapy room with reptiles in an exposure therapy session. So one might look at what Scarecrow's doing and be like, well, that looks like exposure therapy. And it's not. And one of the biggest reasons is that the patient is the one who decides what happens to them. They're the ones who decides, this is as far as I'll go, or yes, I want to look at a picture of a snake right now. Yes, I want to look at a YouTube video of a snake. That's as far as I'm willing to go right now because my fear and anxiety is so intense. The therapist is seen as, certainly a coach. They teach them various techniques to get through the anxiety, but in no way does the therapist or psychologist push this on to the patient, right? I'm not throwing snakes on people. I'm not throwing spiders on people. That's unethical, right? That's where Dr. Crane is clearly doing something in his practice or in his experiments that's not helpful to people. The important part of the exposure therapy is that the patient makes the decision to do it and is willingly doing it. If you force it on someone, it may actually make them more fearful and anxious.
You actually bring up a interesting point there. Let's talk about the gas a little bit. Now, clearly there is no fear toxin, but for the sake of the story, let's talk about what that fear toxin is doing. Mm-hmm. One would think, well, constant exposure to this fear toxin, eventually you would stop fearing the thing that is scaring you. However, you just said that you have to be willing, or otherwise it could be, B, making it worse. What is this toxin doing? Like, what is a phobia? What is it chemically doing? What is it psychologically doing? Like, what are people suffering from that this gas might be inducing?
Well, it's interesting because it sounds like, or at least from the episode, it looks like this toxin is eliciting a phobia that's already there, right?
Right. Scarecrow breaks into the university bank and puts guards down.
No spiders! Get them off of me! No!
He puts Batman down.
Fight all you want, Batman, but you must succumb to the fear.
It's clear that his father is disappointed in him.
Bruce, you have failed me.
Father?
Later on, he gets hallucinations, I believe, of even Summer Gleason talking about how he's failed Gotham, and so it's not just his parents that he's worried about. It's all of Gotham. So what is it that this gas is doing to these people?
I would say it's not so much eliciting a phobia. It's much more complex, right? Because you said that Batman it's almost like he's having these visual hallucinations and auditory hallucinations, but all of the messaging is the same, right? You've failed me, you failed Gotham City, you're not living up to your name, you're not doing what you said you would do to protect these, to protect the city and keep people safe. And so that's not so much a phobia as it is a fundamental core belief or a fundamental schema, if you will, about oneself. And it's clear that for Batman, his core schema is about his ability to do his job, his ability to keep people safe, to protect the city, and to prevent what happened to his parents from happening to other innocent people. And his mission is essentially translated by his actions, by all of the the hard days and nights that he's out in Gotham City fighting these villains and criminals and putting them into Arkham Asylum. So what's interesting is that the fear toxin, for some of the guard, it was like, well, he's hallucinating that he's covered in spiders and he's having a panic attack, and I think most of us would find that pretty grotesque. Did he have this phobia before then? I don't know. It could be that this toxin seems to interact with the brain, with some neurochemicals, neurotransmitters, perhaps in the amygdala, which is the fear center of the brain. Again, this is all fictional, but maybe it somehow elicits fundamental fears that people have. And for Batman, it's a lot more complex, right? It's not just spiders or snakes. Certainly it's not bats, but it's this fear of failure.
So something you just mentioned a minute ago with the fear toxin is that it might be tapping into a pre-existing fear, or it could be turning something against someone. It might be creating a fear of something, which we kind of see when the Scarecrow pumps in the gas into sort of the benefit where Dr. Long and everyone is, and they suddenly see Batman as this sort of nightmarish giant bat. Clearly that entire room doesn't have a fear of bats.
They all had a bat phobia, apparently.
Yeah.
I think that scene is important because remember in the beginning of the episode, we started with this notion or Bruce Wayne's notion that he's a disappointment and that he's letting people down. So what's interesting is that at this event, this benefit, you have all these, people of high society, folks that are donating to the university, really important folks attending this party, and this fear toxin is released into the room, and they all attack Batman.
It's a giant bat!
Batman's in the room to have his face off with the Scarecrow. But was that his fear, or was that everybody else's fear? Because ultimately that plays back into his worry or his concern that he's not doing his job and that he's a failure. I mean, everybody's attacking him and they essentially are lashing out at him and yelling things at him. And that's ultimately what he's afraid of.
They all panic and begin to attack him as a big group. But yes, you're absolutely right. It could then reinforce his fear that the city is afraid of him or mad at him or
right. I think it was nicely done, that scene. I think it was important that we're seeing him essentially being taken down by society because they're no longer on board with him. They're not aligned with his mission anymore, and he's being beaten down. So right. I think it's kind of a cool scene.
And then we get to sort of a classic ending of a Batman the Animated Series episode, which is that
a blimp.
A blimp. Yeah,
they all end with a giant blimp.
Yeah, you've got to be on a blimp, a dirigible. Nigel gets hit with the dart that was intended for Batman, who, by the way, is already suffering from.
He apparently got the extended release fear toxin.
Yeah.
Because he is still hallucinating from the first dose that he had, way back at the university.
It hits him.
Bank.
It hits him in, high stress situations, I guess.
Right, which is what extended release medications actually do. It sort of comes in doses or in waves. So I don't know. I think that's what was supposed to happen because I think the Scarecrow mentions that he's still being afflicted by the fear toxin. So he knows like this is supposed to happen.
Right.
He's going to have these episodes of hallucinations or scenarios where he's going to be incapacitated again because of the intense fear.
But Batman being Batman doesn't need a antidote serum or anything like that. He wills it away.
You are not my father. I am not a disgrace. I am vengeance. I am the night. I am Batman.
It's I think it's a pivotal, poignant, moment there because for me to see this play out, especially as a kid, but now as an adult having this, be my profession, it's incredibly inspiring, I think, and powerful because we have what he's envisioning or hallucinating about his worst fear. He is in the middle of this interaction where he could potentially fail. And he even says, not now, why is this happening to me now?
Although I think it's interesting that the thing he says to get it to go away is he's almost deflecting. Because, you got Thomas Wayne hovering in the clouds and saying, oh, you're such an awful son, you're such a disappointment. And Bruce, if we can say Bruce, inside the cowl.
Yeah, he's in there.
He doesn't say, I'm not a disappointment. I am a Wayne and my dad is proud of me. He says, I am vengeance, I am the night, I am Batman. He's like separating the two.
I see this completely differently. I see it as someone who is very vulnerable, nearly incapacitated. He's holding on to the blimp, right? He's in this moment where he's so weak and he gets a moment of bravery and courage and says, no, I'm not going to give in to this voice, this image that's saying you're not valuable, you're not worth it, you're not living up to your name, you're a disappointment, you're a failure. He's finding the strength in him to say, no, I am Batman. I think what you're seeing is this division or separation of identities, and what I'm seeing is integration of identity.
What I am seeing is him saying, I am Batman. I have no interest in engaging emotionally because I have anti-personality disorder.
No.
I have antisocial personality disorder, as we established in the last episode.
I would say that you are entitled to that opinion.
I'm kind of kidding. I know. I am, but it's an interesting idea that he goes with I am Batman and not,
right.
No, I make this city proud.
Right. It almost makes it look like in order to overcome this, he has to push away his family name and anything that has to do with Bruce Wayne and kind of solidify this idea of like, no, I'm Batman. I'm this made up thing. I am this image or this symbol.
He doesn't say this city needs me. He says, I am vengeance. I am the night. I am Batman. Yeah. Well, you were 5 minutes ago, too, but the city hates you. Your parents are, disappointed in you.
But I think for us to see this from our end as human beings and as...
It is a very cool, very heroic moment.
Right.
And the episode ends with him knowing that he is making his family proud, that he is not a disgrace to the Wayne name. Because he's vengeance.
He is the night.
He is
Batman.
So as always, we like to introduce a little reality into our episodes. There is no fear toxin that we can speak of, thankfully. And no one who tries to use things like that. But there have been psychologists and psychiatrists and doctors and you psycho folk.
Us crazy people.
You crazy folk who do experiment on the wrong side of ethics with their subjects. One of the most famous cases, of course, was in 1920 with the John Watson and his assistant Rosalie Rayner at Johns Hopkins University, and their experiments with little Albert.
Right. Most people remember Pavlov. Remember Pavlov's dog?
Yep.
And that classical conditioning study where he would pair meat powder with a bell tone, and if he did that several times, this dog would associate the meat powder and the bell tone, and soon he would just ring the bell and the dog would salivate.
Right.
So that's your classic study of classical conditioning. I think Little Albert is a lesser known experiment in psychology that essentially studies the same kind of association, but Watson, the experimenter, was interested in using human beings as participants instead of animals. And little Albert was an infant who was chosen, I believe, because his mother was associated with the lab or the university. I can't remember, but they chose this infant. And he paired loud noises with a little white rat. And as you can imagine, just like Pavlov's dog, this poor little baby learned to associate very loud noises with this white rat. And the study has become...
And it was other things too. Like it wasn't just like a rat necessarily. They would be like a rabbit, monkeys, dogs. They would even wear masks. Sometimes they would have like beards and hair on them. Sometimes they wouldn't. And so eventually it got to a point where this baby would essentially begin to associate fear, this loud noise, with anything that was furry.
Right. And the study actually was groundbreaking because we understand that what you're talking about is called generalizability. So it wasn't just the white rat that this child associated with this loud noise, and it was a clapping noise.
Yeah, it was a steel bar being hit by a hammer.
Yeah, okay. So a steel bar being hit by a hammer for a baby is intensely fearful. It's there. Obviously, this baby is going to react with fear and distress. So imagine if you pair that with this, small little fuzzy animal, which we call a conditioned stimulus. We call that the conditioned stimulus because it is naturally not something that people would be scared of. The unconditioned stimulus is the loud noise. That is a sound, a stimulus out in the environment that would scare anybody. It's universally fear-inducing. That's what we mean by unconditioned stimulus. Now, the white rat has to be conditioned to something scary, hence the tone, the loud noise between the steel and the bar. I guess the benefit of this study is that we learn about generalizability, which is that things that are very similar to this original white rat stimulus would also induce fear in this poor baby.
So you talk about the benefits of that experiment, but by today's standards, that would be considered unethical.
You're
Mainly
right.
because Albert was only 8 months old when they started these tests on him.
Right. This kind of study today would probably not be approved by any internal review board because it could be dangerous or harmful to an infant. So, sadly, we did not get to see a lot of the Scarecrow's origin here. We got a little bit about his adult life, but one story that I'm particularly fond of outside of the animated series is the most recent exploration of the Scarecrow's origin in The Dark Knight. In fact, in Volume 2, Cycle of Violence, written by Greg Hurwitz, one of my favorite writers when it comes to origin stories and psychological trauma.
He did the Penguin.
He did Pain and Prejudice, which explores the Penguin's origins. And in Cycle of Violence, Batman faces off with the Scarecrow, and there's this really interesting history there with kind of how the Scarecrow came to become fascinated with fear and it's a really great story. So just if folks are interested in learning more about some of his backstory, this is a great story to read.
Cool. So that wraps up episode 3 of the Arkham Sessions. Join us next week. We'll take on the Joker once again with The Last Laugh. This is specifically one of your favorite episodes.
Indeed. It's definitely one of my favorite episodes because of the music.
Nice. So we'll take a look at that next week. Until then, have a great week. This is Brian Ward.
And Dr. Andrea Letamendi. Happy New Year.
Happy New Year, guys.